Welcome to the session on mental health, that is a part of BGSE 001. Before we go to mental health, it is important to just to review what all we have covered. We have already learned about gender and various basic concepts about the health issues and its social context, and health issues in non-normatics. Mental health is one of the very important aspect in the health. There is no health without mental health. Even the WHO says, if you remember the definition, health is defined as a state of complete physical, mental, social well-being and not merely the absence of disease and infirmity. Mental health is more than the absence of mental illness. It is a vital to individual, family, community and the society because it impacts the physical health, family health and the community health. Concept of mental health as per WHO, a state of well-being in which individual realizes his/her own abilities, can cope with normal stresses of life, can work productively and fruitfully and is able to make a contribution to his or her community. So you can see here it is a state of well-being where individual has the ability to cope up with the minor stresses of life which every day all of us faces, maybe at home, at workplace, dealing with the people or contributing towards our work or family or community. Mental health is foundation for well-being, already I have told you in the definition, and effective functioning of an individual and family and community. This is a core concept which is considered with its wide and varied interpretation across the cultures. That means every culture, every society have their own culture, have their own values, have their own beliefs. So in whatever way they interpret the mental health, it influences the physical and the health of the individual, family and the community. Neither mental nor physical health care exists alone. As already I have told you, mental, physical, social functioning of an individuals are interdependent. I will give you examples in the coming slides. You will be able to understand what I mean to say. Determinants of mental health. As you remember, we have learned about determinants of health. Same way, there are certain determinants of mental health also. Mental health and mental illness are determined by multiple and interacting social, psychological, socio-economic, environmental and biological factor, just as health and illness have determinants of health. Risk of mental illness is associated with poverty, including low level of education, poor housing, low income, unemployment. These are some of the social determinants. Vulnerability of women and disadvantaged people to mental illness may be due to experience of insecurity, hopelessness, rapid social changes in the life and society, and risk of violence and physical ill health. So you can see even the vulnerable group have determinants of mental health which is affected by certain factors. Research have shown that mental health can be affected by non-health policies and practices. For example, what are the policies and practices regarding the housing, education, work culture, society expectation, child care, family care and many other factors. Mental health and behavior. Mental health is linked to behavior. Mental, social, behavioral health problems may interact as to intensify their effect on behavior and well-being of an individual. If the individual is affected, because the individual is living in a family, family will be affected. and family is a part of community, community is also affected. Many researchers have shown that there are difficult conditions which lead to mental health issues. There are issues may be related to social health, mental health, psychological health. Maybe they may cause due to unemployment, low income, limited education, stressful working condition, gender discrimination, unhealthy lifestyle, human rights violation. And if you see the violence, abuse of the children and the women on one hand may cause the mental distress. On the other hand, they may cause associated health problems like heart disease, depression, anxiety in the people. That's why it is being said both are interdependent on each other. Many a times it is being seen in the hospital, if person is sick, person is having physical problem, it may affect the mental health problem of the person because the person may be anxious, may get depressed, and in turn have family will also be will have anxiety and depression. Because one person is sick in the family, this may affect the family life also. Mental health for each person is affected by individual factors and experiences, social interactions, social structures, and resources and cultural values. It is influenced by experience in everyday life in family, school, and at work. I hope I had made myself clear how the mental health of a person is affected by their own experiences, social interactions, and the resources and the culture. Many ethnographic studies show that people living in adverse conditions, social settings such as slums, faced with problems such as migration, displacement, poor living conditions, unequal distribution of amenities, demolition of houses, homelessness, and communal and ethical disharmony. If the disadvantaged people who are living in these conditions, they face not only direct problems related to housing and the basic amenities, but they also face the mental health issues. Because displacement, homelessness, if the basic amenities are not available like water, electricity, health services, there is a obvious reasons that there will be depression and anxiety and restlessness among the people and the family members. This will impact even the small children in the family because they may not get education properly, they may not get health services properly, which may impact their physical problems also. There are some concerns about, you can say, individual and families and the communities that influences the family health, like hopelessness, demoralization. There can be addictions, cases can be there. Maybe the father is addicted. By seeing the father, the children may also get addicted. They start taking drugs, cigarette smoking, and alcohol consumption at the early age. Maybe due to all these things, there can be distress and anger and depression, hostility and violence in the family. The women in the family may face hostility and the violence. If the small children see violence and hostility in the family, this impacts their mental health. They are not able to cope up with the stresses at the home, and when they go out, it impacts their social life also. Many studies suggest that ill patients with negative attitude had worse outcomes than those with positive attitudes. It is being seen in the hospitals. If the patient is admitted, even if the patient has some serious disease, if an individual and the family have a positive attitude towards that illness, they accept the illness, they accept the treatment, recovery will be fast. They will have less mental illnesses, mental disorders, less stress, less emotional disturbances. If the patient is having less emotional disturbances, anxiety or depression, then the family will also have less depression and anxiety in the hospital. Otherwise, what happens? If an individual is sick and is not having a positive attitude, it impacts the family and especially the caregiver. If husband is sick, the wife is there to take care or children are there to take care, it impacts their life also. It impacts their work, it impacts their life at the home also. Malnutrition in infants can increase the risk of cognitive and motor deficits, and heart diseases, cancer can increase later on in the life, which can even increase the depression not only of the children when they become adolescents and adults, but also of the family members. Hypertension may arise through psychological stress, burnout, and in turn related to occupational and other factors or impact the environment of the family and the office. Poor social support, social networking have impact on the physical and psychological health of a person. There are many people who do not have much of social support. They are not very outgoing person. Their social network is very small or they are not, it's very weak. And whenever they need any support, there is no one to take care of them. That's why it impacts their physical health and the psychological health also. People living with HIV and AIDS and their families experience stigma, discrimination, which in turn leads to anxiety and depression and various other mental illnesses. Even many a times the patient do not disclose even if they have HIV and AIDS even to their family members because they think their family will suffer due to them. Persistent pain, it is being seen, it is being linked to low productivity, and if there is a low productivity, many a times a person will be very depressive because or maybe very anxious because the person is not able to give what their family or the occupation or the office is expected to give. Sometimes they may lose the job also if pain is unbearable and their productivity goes very down. So you can see these are some of the examples which I wanted to give you to understand how the physical health impact the mental health even of a general population irrespective of the gender also. Mental, neurological and substance use disorders, that is MNS. MNS are common and highly disabling and associated with significant mortality. Human, social and economic toll imposed by lack of attention to MNS is considerably high all over the world. Some segments of population are disappropriately affected by MNS. Here you can see the women, children who have experienced violence, soldiers returning from war, migrants and refugees displaced by through if there is a conflict in that area or there is a war in that area, their housing is being displaced. The poor and the other vulnerable group like LGBT also. It is being estimated that at least 10% of the world population is affected by MNS and 20% of children and adolescents suffer from some type of mental disorders. And if children and adolescents are suffering, you can see when they will become adult and the elderly, the intensity or the prevalence may be even much higher. Burden of mental disorders. 450 million people suffer from mental or behavioral disorders all over the world. Nearly 1 million people commit suicide every year due to various reasons. Even in the COVID or during disasters, it is being observed people are not able to cope up, especially when they lose the job. They commit suicide. 1 in 4 families have at least one member with mental disorders. Family members are often primary caregivers, but extent of burden the mental disorders on these family members they face is very difficult to assess and quantify, and consequently often it is being ignored. However, it has a significant impact on the family quality life because the caregiver are mostly women, sister, mother, and they take care of their families and the sick person also. And if they have any mental disorders or illness, they hardly come forward because they know if they fall sick, whole family will be disturbed. In addition to the health and social cost, those suffering from mental health are victims of human rights violation, stigma, discriminations, even both inside and outside the health institutions. There are the instances where it is being seen a person is having any mental illness or disorder. Many families do not want to take them to the psychiatric hospital or the psychiatrist. They feel it is a stigma for the family and an individual. Prevalence. During adolescence, girls have a higher prevalence of depression and anxiety disorders and engage more in suicidal ideation and attempts. They do not do some many times the prevalence is less of suicide, but the idea of suicide and attempts are more. In boys, experience are more actually there of suicide because the role, gender role of a boy is they cannot express their feelings. They can only express their anger or engage in high risk behavior. Therefore, the suicide commitment is very high among boys. In adolescence, the prevalence of depression and anxiety is much higher in women because already I have told you, women are caretakers of the sick, caretakers of the family, and women are likely to exhibit serious form of bipolar depression, and they do not come forward for their treatment. And if they get the treatment, that is the basic primary level treatment, hardly they go to the tertiary level hospitals for the treatment. In older age, although the Alzheimer's disease, that is a degenerative disease of the brain, is usually occur after 65 years of the age and is reported to be same for the women and men. But still, in the older age, women are more anxious and they get depression also very soon. Underlying factors, already I have told, just we can review some of them. Genetic and biological factors play important role. Higher prevalence of depression and anxiety disorders among women. Mood swings related to hormonal changes are a part of menstrual cycle or after the menarche or when the woman faces some surgeries, there can be hormonal changes. In case of antenatal and postnatal depression, the psychological factors, hormonal factors result in elevation of risk of maternal disharmony, inadequate social support, and social or the financial situation may cause the depression, anxiety, or the postnatal depression in the woman. It is very common among women who are vulnerable or who face social, psychological, or economic constraints in their life. Gender and mental disorders. Studies highlight that women experience psychological distress and disorders associated with reproductive health conditions and the problem. Infertility, hysterectomy increase women risk to affective or neurotic syndromes. Feeling of lack of autonomy, socially determined gender norms, roles and responsibilities, and no control over their own life, own decisions about their life are associated with depression in the woman. Feeling of lack of autonomy. They cannot take decision even when they are sick. Can they go to take treatment? Where to go? Who will support them financially? Who will take care of their work if they go to the hospital? So these are some of the concerns which women face. Events such as illness, death of the children or death of a husband, job insecurity, insecure working place for the women are significantly cause depression among the women because these factors influence the mental health of a women, adolescents, girls. Distress caused by women by marriages, in-laws problem, unwanted pregnancies, unwanted abortions, and enforced nurturing role again causes psychological disorders among the women. Data indicate that stress is associated between gender-based violence and mental health. Gender-based violence is increasing not only in our country but all over the world. Especially in the COVID, it is being observed there was increase in gender-based violence. Women faced lots of violence at home and had various mental illnesses and disorders. And there is a need to study about these factors because it not only impact the women, it impact the whole family, it impact the children, it impact if the mother is antenatal, if mother is postnatal, it impacts the health of a newborn, impact the health of an adolescent if adolescence is there in the family. Later on, they are not able to adjust with their own family again. Mental studies related to women mental health highlights the significant relationship between lifetime experiences of physical violence by an partner and suicidal ideation. That's what I was explaining with the example. Because if a girl or a boy sees the husband beats the wife or father is beating the wife, there is a violence in the family, it impacts their mental health. And when they get married, they also have a impacted family. Mental health conditions affect all areas of life such as school or work performance, relationship with the families, friends, ability to participate in the community. Due to demographic changes, there has been 13% increase in mental health conditions and substance use disorders in the last decade. You can see it is an area of concern, but it is a very neglected area, especially in our country. If any person has mental illness and disorder, they are not being taken to the hospital at the early stage. And if they are taken, the treatment is not proper because stigma, family prestige is associated with mental disorders and illnesses. Mental health conditions cause 1 in 5 years life with disability. 1 to 5 people in post-conflict setting have mental health conditions. Around 20% of the world children and adolescents have a mental health conditions with suicide and leading causes of death among 15 to 9 years of age. So adolescence is an age, as you know, there are physical, psychological and body changes. And this is the time they need care, they need social support, they need support of the parents. If family is disturbed, then they will have mental illness, the suicide rate may increase, and if they have mental illness, they may have the, you can say, they may smoke more, they may addicted to the drugs or alcohol. Like this, all the family members, all the generation life course perspective is very important to understand. COVID and mental health. During COVID, the pandemic, it was seen that 93% of the communities worldwide countries has actually affected the mental health services. Not even the physical health services, hospital services were affected, but the need for the mental health was immense. That's why globally it is being observed the mental health of a person, of a family and community is very important, and mental health can be enhanced by effective public health interventions. Mental health policies, programs in every country should incorporate understanding of gender issues, because girl today is a girl child become adolescence, tomorrow she will be a woman mother and look after the family. Already with the examples I have tried to explain you how it will impact the health of a woman, mental health, and parallel the physical health will also be impacted, and even the social health of a woman is also impacted. I think in this session you are able to understand what is the importance of mental health, why it is important to associate with the gender and the mental health, life coach perspective, and what are the determinants of the mental health and how it can be prevented. It's very important to take care of the women and the girls who have mental illness or disorders at the early age. Thank you so much.